Welcome to Rela Dental, where we help you to smile with confidence. When you look at our logos, you see us saying, smile for miles. We want you to smile for miles. And today, because we want you to smile for miles, we've come up with something new, the podcast. We can call it the Rela Podcast. And this will come to you every week. We talk about the topical issues in dentistry, the things that are disturbing us. Have you ever had a toothache throughout the night and you can't even sleep? Such small things that you might take for granted, but may at a certain point become very, very complicated. And today I have two doctors, Dr. Edward and Dr. Francis Lako. Dr. Lako is a senior oral and maxillofacial surgeon, a guy who does the complicated things in dentistry. We'll get to that. And then Edward here is our guy. He will tell us the basics. He will tell us what we think are small issues, but they are not small, because if you neglect them, you'll end up in Dr. Lako's hands. It means that things have become complicated. So, Musao Edward, let us start by understanding what a toothache is. To a common man, what is a toothache?
Well, a toothache is pain inside or around the tooth. So it can range from mild to severe. If you ignore it, from mild, it starts slowly, and it ends up as a complication. It can give you a severe pain. Yes.
So if I'm eating food and suddenly I feel pain in my teeth, is that a toothache?
Yes, that's a toothache. Basically, it is mainly from inside or outside the tooth. So when you're eating food, it means that food has entered the cavity inside and it has irritated the inner part of the tooth, which needs to be attended to. So that food, you feeling that pain, it's communicating to you that there's a problem in your tooth. Yes.
Let's talk about the causes. What causes toothache?
Well, there are a variety of causes of toothache. The common one is dental caries. Tooth decay is a main cause of dental pain. So when you look at dental caries, they start slowly and they progress. If you don't intervene, it really worsens and it brings you complications. So at first, it starts with a small cavity and progresses. With that small cavity, it is still localized at the enamel. The enamel is that white part you see outside the tooth. So here it is here. So the cavity starts slowly, like this one. It is very small. From this stage here, it is not painful because we have different parts of a tooth. We have the enamel, the outer part of the tooth. Then we have the dentine, that is the middle part, which is a bit sensitive. Then we have the dental pulp. This is where the nerves and blood vessels are. So when you look at dental caries, when they're up here, it's not yet in the nerves. You don't feel any pain. The cavity is there. That's why most of the people say, I have a hole on my tooth, but I don't feel pain, because the cavity is still in the early stages. So as it's progressing, it progresses up to the dentine. This is now where someone starts complaining that whenever I drink cold or hot things, when I eat hot or cold food or sweet things, I feel sensitivity or I feel pain. So it means that the cavity is still, it has reached to the dentine. But when it reaches to the living part of the tooth, of which I said is the pulp, which has the nerves and the blood vessels, this is now when the pain becomes too worse. You can't treat it by yourself. Either you do what? This pain is going to haunt you, that go and see the dentist. Something is wrong with my tooth. That's when most of the people come, when their teeth is at this stage. Yes. So then here, the tooth is now hopeless. But at this stage, the tooth is worse. Yeah. So dental caries is one of the cause of the toothache.
Then what are the other causes?
Then we have gum diseases. Gum diseases are also part of the cause of dental toothache. So it may not be the tooth, but it is the the gum is a supporting structure of the tooth. It has to pain you. So then the other one, we have dental abscess. Yes, then we have fractures. When your tooth fractures, it can also cause toothache. Then we have infections inside the tooth. Yes, those are the main causes of dental pain. Then maybe the other one is impacted wisdom teeth. Maybe in our next discussion we shall discuss about those impactions, of which I'll be there with Doctor. Doctor will bring it very well, and we shall be telling you the right thing, what to do. So impacted wisdom tooth, those are also most of the causes of dental pain, and that one can pain you. Even you may think all the teeth here are paining you, but it's only one tooth which is causing that. Yes. Then we have pericoronitis. I know pericoronitis is a inflammation of the gum tissues surrounding the tooth. So it mainly happens on the behind teeth. Yes, it happens on the behind teeth. It is inflammation around the tissues surrounding the partially grown or erupted tooth.
Welcome to Rela Dental, where we help you smile with confidence and smile for miles. Today we are unveiling something new for Rela Dental, for our clients, for our audience. The Rela Podcast. This will be coming to you weekly. And you don't have to do anything apart from follow us on TikTok, follow us on Facebook, follow us on Twitter. We'll bring you everything you need to know about dental care. We are the experts. And today I have two doctors, Dr. Edward and Dr. Francis Lako. Dr. Lako is a senior oral and maxillofacial surgeon and director of Rela Dental Clinic. We are going to talk about toothache today. I'll start with you, Dr. Edward.
Yes.
What exactly is a toothache?
Part that supports the tooth, that is the gum, then the bone, the jaw bone, and the periodontal ligament. Then that pain that is atypical. It's associated with the pain, but it's not the tooth. It's not the tooth which is causing it, but there are some chronic conditions that cause it. So the pain which comes from the pulp is mainly caused by cracks on the tooth. Then the common one, which is dental caries. Yeah. Then we have cracked fillings. Yes.
Simplify it for someone who is not in the dental field. When you say cracked fillings, what exactly is that?
Yes. There are those fillings that when you put them on, they get damaged. Like maybe when you bite something hard and it breaks. So it exposes the tooth and the infection passes there, and the person starts feeling pain when the infection enters the living part of the tooth, which is the enamel. Yes.
Let down dental caries for us.
Dental caries starts in a simple way. Take for example, in this picture. So this is a tooth. So this is the enamel, that white part on your tooth outside, the one you see outside. Then this is the dentin. This is the sensitive part of the tooth. Then you have the pulp. It has the blood vessels and nerves. Then we have the roots. Then you have the gum and the bone. So then when you eat food and you don't brush, the food will get impacted inside and gets attached. Bacteria will feed on this stick and the food will ferment and form acid. That acid will now start decay, like digging inside the tooth, digging inside the tooth. So at this stage here, you don't feel any pain. But when it enters down, it progresses down and reaches the dentin. You now start feeling sensitivity on cold and hot. But now, when it enters the pulp, the living part of the tooth, which is this one, it enters there. This is when the pain becomes so intense and very, very painful. It can wake you up at night. Yeah.
Okay. There are times we get ache in the tooth, but we cannot take any action, or we are told when you place aspirin in the tooth, you get relief.
No, those are the myths people have. It's not supposed to be like that. You're supposed to take medicine inside and the medicine enters the tooth and work. But you don't have to put medicine on the tooth which is paining.
Okay, so when does toothache become an emergency?
Well, when you get a swelling on your face, that is an emergency. Then when you start feeling fever, your body is now telling you that there is something wrong with your body. You have to identify that thing and remove it very quickly. So that toothache gives you fever. Then when you have persistent severe pain, that is an emergency. You have to go and see the dentist very fast. Yes, then when you have, like, if you get an accident or when you're fighting, then that tooth is knocked out. That is an emergency. You have to get that tooth and you run to the dentist. Yes, they will fix it.
When I see blood from the gum, I can see it all?
No, that is an emergency. When you see bleeding in the gum, that is an emergency. You have to rush to the dentist and they work on it.
Yes. So what happens? Does it have to be removed or extracted? That's the right word. Do I have to get the tooth extracted whenever I get some kind of ache?
Well, it depends on the pain you have, but when it's severe pain, but of course you have to come to the dentist and the dentist first examines, and he is the one to decide whether this tooth is to be extracted or to do root canal on it. So that pain that is intense, that wakes you up at night, it means that the decay has already gone beyond. So to give your tooth a second chance, you have to do root canal. Or the other option is to remove it, of which we don't advise to remove teeth. The teeth we have to remove are those teeth which are really hopeless. You need to remove them. But the ones which have some structure, at least we can do root canal on them and you save your tooth. You give your tooth a second chance. Yes.
You mentioned the word hopeless. It's okay. It sounded in dentistry it means something else. In real life it means something else. So I want you to expound on it so that people can know, when does tooth become hopeless? Or what is hopeless?
Well, a hopeless tooth is that tooth that can't be restored, that can't be brought back to its whatever. Take for example the tooth, you wait until the tooth disappears from the mouth. The tooth has been, the caries, the decay has been eating out the tooth. eating out the tooth, you're delaying, and it remains the roots only. That is a hopeless tooth because we don't have a way of saving it. Take for example, in this chart, this tooth is a hopeless tooth. You can't really do anything here unless you have to just remove it, because there are no supporting structures whereby you can deal with it again. Yes.
So from that explanation, we know that there are times when your teeth or tooth cannot be saved by the dentist, even by the senior of them all.
Yes.
Now, when it comes to that, your tooth is hopeless.
Yes.
Learning never ends. So we are learning something new today. And is every toothache the same?
No. The toothache, every toothache is not the same, but it depends on the level of infection. Take for example, we said at first, on the first stages of tooth decay, it is only local. It's only on the outside part, which is the enamel. There you don't feel pain, but you feel the disease is there, that decay is there. So it upgrades, enters the dentine. There now we start feeling pain. I mean, you can also start feeling a sensitivity around when it's on the dentine. So it's different from the start. At first you're not feeling pain, but now it has continued, the infection has increased and it has deepened down. It is now a different type of pain. So when it continues down up the palp, it becomes more intense and severe. So it depends on the stage and the level of infection on the tooth. Yes.
And sometimes the pain is not in the tooth, but inside the gum.
Yes.
Is that the same?
Yes.
Should I worry when I get pain in the gum?
Yes. At first, I think at first we talked about the causes of pain, and I said there are 3 categories of pain. There's pain from the tooth, which is from the pulp, and there's pain on the supporting parts of the tooth, which is the gum, the bone, and the periodontal ligament. Yes. Then there's that pain which is a typical pain. It's not from the tooth, but it's from something else, like chronic damages to the nerves. For example, trigeminal neuralgia. Yeah, then
Doctor, that is too complicated.
Yes.
You simplify it so that the person out there who is not from the dental or dentistry background can understand what you're saying, so that when they get that kind of pain, they know this is the time for me to go and see the specialist.
So we talked about the pain around the gum. So there's that pain that comes in the gum. It's inflammation of the gum. There are gum diseases. So they are mainly caused by some diseases. Then there is food impaction. When food is impacted on your tooth, it irritates you a lot. And sometimes when there is a trauma on the gum, it can also cause bleeding. Yes. So when you see such things,
So trauma is injured, right?
yes, injuries. Yes. So when you see such things, you need to go and see the dentist, because that bleeding does not come alone, because it also comes with something else. Yes.
Is there anything people can do before seeing the dentist?
Yes. Toothache is mainly funny. It can surprise you anywhere. Maybe when you're traveling, or you're sleeping at night, and it just comes in any time. Well, at least if you don't have any painkiller at that time, at least try to rinse with warm salty water at night. It can relieve somehow. Then also, you should avoid putting medicine inside the tooth, like most of the people doing that. If you put the medicine direct inside the tooth, it will reduce.
You will feel and
Yes.
you'll be fine.
Yes. Then if you have, you should get also appropriate painkillers that can help you. Yes, painkillers can also relieve the pain somehow. Then you should of course, seek for medical attention.
for your tooth.
So this means that taking painkillers is not enough. Take it as a relief. Yes, then proceed to see the dentist.
Yes, and painkillers are also not good. When you take them for long, it brings you some bad side effects. So you need to at least take a painkiller that you will and immediately you get a chance, run. In the morning, you go and see the dentist, and the dentist will work on you. Yes.
Doctor, is there any way we can prevent toothache?
Yes, we can prevent toothache at home. Yes. Number one, the common thing you have to do is to brush. You have to brush twice a day with a fluoride toothpaste. Yes. Then you should floss. Flossing, you should floss all the time. I don't know whether you know flossing.
I do, but the person watching us might not know.
Yes. Flossing, you can get those, they're sold anywhere. Right now, I see them very common.
Okay, so you can go to a supermarket and look for dental floss.
Yes.
You can go to a pharmacy and get dental floss.
Yes.
And maybe in the next edition of our podcast, we'll explain how to floss.
Yes.
Because I see in most cases people use toothpick. That will be a topic for another day. But flossing is one of the things we need to do to ensure that we prevent toothache. Okay, anything else?
Well, toothache is actually not a disease, but it is a symptom that is telling you that there is something wrong with your tooth. You need to work on it. Yes, and the earlier you go to the dentist, the more you save time and the more you can save that tooth.
Tell us something about sugary snacks.
So sugary snacks, on a prevention of dental caries, at least you limit eating them. Sugary snacks and drinks. We don't say that you should stop eating them totally, but you limit, you reduce on the amounts. And when you eat them, at least brush. Yes.
Okay. So sugary snacks, sugary drinks, and sugar itself are a danger to someone's tooth. That's what you say.
Yeah.
If they are taken in excess.
Yes.
Okay.
Not in excess. Even a small one can
be problematic.
Yes. It can remain on your tooth and it brings a problem when you don't clean it. Yeah.
And when everything fails, you have to check with the dentist. If you fail to brush, you fail to floss, you maintain the sweet tooth, you love the sugar so much, and then there's something. Some people don't replace their toothbrush often.
Yes, that's also another problem. Most of the people don't replace their toothbrush. You find
danger in that.
You find someone with the old toothbrush. Yes, but mainly you're supposed to replace a toothbrush after every 3 months. Yes. So you don't have to be with one toothbrush all the time.
What's the danger in not replacing it, in not changing the toothbrush often?
Yes, you see, when you don't replace your toothbrush, it's like a tire of a car. When you use it, it also becomes so now. But on a toothbrush, those bristles where they get distorted, and you find someone, the thing is even broken. Those bristles are down, but they're still using it. Those ones are not working. Yes.
Okay. And how often should people come to a dentist?
You're supposed to visit a dentist after every 6 months. That is twice in a year. Yeah.
Okay. That is Dr. Edward for you. But I know that a toothache can start as that little pain, the symptom that he has talked about. It becomes complicated. I heard Dr. Lako talking about abscess. These things sometimes are also complex for me from my background as a communicator. But I want Dr. Lako to explain to us when everything else fails, everything that Dr. Edward has explained fails, and it gets to you, what does that mean? Is that the situation of hopelessness, or it can be, you can be the savior?
Thank you, Sylvia. Toothache can progress if it is not checked. Just like Edward said, once you get a toothache, you need to check with your dentist. Once that thing is not checked, and it's very common, a number of occasions people ignore it. One interesting thing with the toothache is that when it is still in that hard part of the tissue called the enamel, you don't feel the pain. You see a cavity, it's something dirty, but you don't bother about it because it's not paining. And because of the acid which is formed, it breaks down the hard tooth structure, the white part which is shown there. It keeps on breaking until it reaches a less sensitive area called the dentin. That the interesting thing with the toothache, that less sensitive part, you only feel it when you have taken something hot or something cold. So what does Sylvia do? If the thing is hot, say, let me take the one which is not hot. I take the one which is warm. And you continue, life continue. It can even go for 6 months, even a year, before it reaches that very painful part. That's the pulp. That's when you don't sleep at night. Or it keeps on paining throughout the day. You keep holding yourself. That's when you see people coming. So what I'm saying, that it's important that you go even when it's at the earliest stage, so that you don't either lose the tooth or you don't undergo expensive treatment. Now, when the worst results of a toothache is infection. Recently, we are having a discussion about malaria, and one of a professor told us malaria is dangerous, it kills. And I want to tell you, dental infection kills. As a specialist who had been running treating dental infection, the biggest cause of death in dentistry is infection from the tooth or from the surrounding area. What happens here is that when the tooth decay reaches the pulp, infection spread to the apex of the tooth. It destroys the bone, pus forms, and interesting, and I love God's creation. You know, God has created us with spaces in our face. We have spaces. We have sinus. We have spaces on our cheek. We have spaces below our chin. We have spaces around our neck. And now when the pus form, they collect in those spaces. I think that's even a form of a defense mechanism. Otherwise, if it goes straight, you will die. So it collects on those spaces. When now the dentist refer to a specialist like me, I go and do what I call incision and drain. I drain the pus and then extract the bad tooth. Or if it is treatable, it can be treated. But in most cases, if it reaches that stage, is for extraction. So when it reaches that part, you drain the pus and then you treat it with antibiotics, analgesics, and the patient recovers. But if it's left unchecked, it tracks through the space in the neck to the chest, and it can kill the patient. And that's the biggest cause of death in dentistry. So people should not take it for granted. Should go and check when then the decay is still early. I'm going to tell you in the next series of other what also causes abscess apart from dental caries. There are many other conditions in dentistry where abscess is formed, and it goes through all the spaces, and it block your go and squeezes your lung, and you are finished. In my practice, the main cause of death is from, as we call it, sequel of dental caries. How dental caries progress, it can progress to death. So that's important. That
At certain points, I was scared when you say it kills me. Because I know in most cases, people will not go to a dentist when they feel the pain. But what Dr. Lako is telling us, that what starts as pain in your tooth, in your gum, is a sign that there's a problem. And if that problem is ignored, it can become something dangerous, something life-threatening. What services will Rela Dental provide?
well,
Under such circumstances?
under such circumstances, Rela Dental, we are having specialists. We have oral and maxillofacial surgeons. We have other surgeons. What we do is we handle the case by case. If it comes as an infection, we talk to the patient, we get the history of the patient, and definitely we relieve the patient from that. Sometimes you are not able to handle this patient on the dental chair. You will arrange in an environment, a theater environment in a hospital, and you do the treatment according to the presentation by the patient. So we do actually so many things, from infection to fractures, which we shall discuss as we go by, tumors of the jaw, cancers, and the non-cancerous.
Proceed.
Yes.
Can it start as a toothache and eventually it becomes a cancer? Or in the process of studying my history, you realize that it's a cancer?
No, it has not yet been proven that it is a toothache that leads to a cancer, although sometimes people with cancer or tumor have toothaches, in some condition,
Dr. Edward, why does tooth pain or toothache manifest at night?
You see, when the pulp, that's part of the tooth with the nerves and blood vessels, is inflamed, there are some pathological changes in it. There is swelling and increased pressure inside. So when you're sleeping, the pressure keeps on entering the tooth. So that pressure makes the pulp swell, and that's when you feel pain. When the pressure is too much in that way.
Yes. So it's not about time of the day. It's because of the conditions around.
No, well, it comes anytime. You know, the body also tries to fight that infection with a natural immunity, but for it, when it's too much, it can't.
It can save you a once to go.
Yes.
We are coming to the end of today's edition of the Rela Podcast. And to conclude this, I'll ask each of the doctors to give us some advice on how we can keep our dental health at the top. And I'll start with you, Dr. Edward. What advice would you give someone It could be me, it could be any other person, about dental care and how to keep their teeth in good health.
Yes. So, thank you very much. So, for you to have a very good oral hygiene, at least, a very good oral health, at least you should know that your mouth is a gateway to your body. Anything you get, you put in your mouth. So, you have to keep the gates of your body very clean. So, in order to achieve that, at least you should follow a 2-2 rule. Brush twice a day. Then the second 2, brush at least 2 minutes. Then the other one, see a dentist. Visit a dentist twice in a year. That is every 6 months you should see a dentist. Yeah, at least a dentist can detect a problem very fast, earlier than it becomes worse. So I don't want you to come to the dentist when you're feeling pain. That is a very bad thing. At least when you come early, your tooth would have been solved very early. Yes, thank you.
And apart from saving the teeth very early, when you come twice a year to check with the dentist, you will save a lot of money. Because when you come to the dentist when it is too late, it is very, very expensive. And I'm going to Dr. Lako. You know, even in dentistry, I know we want to avoid getting into Dr. Lako's hands, because by the time it gets to him, you know that it is something very, very serious. Dr. Lamo, is there a way you can avoid being in your hands?
Well, I don't think you can avoid being in my hands, because we are still talking of dental caries, but there are certain things that you can't avoid. Things like road traffic accident. It is literally happening every day, everywhere. So, by the way, I'm a Rotarian. And in Rotary now, our theme this year is trying to fight traffic act, road safety. It's actually road safety. It has come because we have noticed that there's too much accident taking place, and it can be prevented by educating the drivers, educating the road users. So still, as the time, none of us, the doctors, would want people to fall sick, but they fall sick. That's the act of nature. Even things like tumor, you hear somebody asking, why am I very unfortunate? Why am I having a growth on my face as somebody is not having? You did not ask for it, but somehow certain things happen. So you can't avoid, but the most important thing is have regular check to your dentist, any medical practitioner, so that they identify and they arrest certain thing at an early stage. Just like I like giving an example of cancer, people detect it early, it can be treated. Yeah, so the early detection is the key. Therefore, early going to the doctors, like me, early, is better, as the doctor put it, and it's twice in a year.
Dr. Lako, earlier I asked, what can Rela do? For instance, by doing this, what is our message as Rela Dental?
Our message to the world out there from Rela Dental is actually to let the world know about what we are and what we provide and what is there in what about the dental diseases. In my practice, almost 40 years in dentistry, I'm retired from the service, but I feel there is a need to give back to the society. The only way and the best way I think I can give to the society is to have this podcast, whereby we'll be giving information to the patients out there. We want the people to get this information, and they can visit their dentist and present the problem so that it's sorted out.
Because,
By the way, doctor, there are people, most of the people say the only treatment for a tooth is extraction. But they don't know other things.
That's the common thing out there.
Of course, extraction is a common thing known by people. That's why there is a saying in Luganda, "Umkuzi wa manyo," isn't it? That's someone who extracts. We are not teeth extractors. There are so many things that are done that we do to restore the face.
Yes.
The function of the teeth. One is to eat. So a sick tooth will never eat. You cannot eat. Two is for beauty. Like when Sylvia smiles, I look at the I see the yes.
Yes.
The other one.
So you must maintain a complete set.
Have you ever seen somebody talking without these front teeth? Have you ever?
They struggle.
All the air
spills,
comes out.
yes.
Cannot speak. So the various, all these are a function of the teeth. Yeah. So it is important. And that one I would have brought it in the neck. But let me tell you, there is a saying in dentistry that mouth is the mirror of the body. By opening your mouth, I can see all the diseases in your mouth, in the body. I can say you are having liver disease. I can say you are having a kidney disease. I can say you are having disease of the blood. I can say you are having tuberculosis. I can see in your mouth. I can say you are having urinary infection, say for example syphilis. You can see from the mouth. They all have their symptoms in the mouth. HIV, Lako for what we call is malnutrition. All those things you can see them from the mouth. So that's what we say. Okay, the mouth is the mirror of the body.
The body.
Yeah. So it's important that care is taken. It's important that you visit your dentist. I won't say you come to Rela, but if you come to Rela, we shall come you. But you have to visit the dentist. Thank you.
Thank you so much. What I'm picking from this is that the mouth is the gateway to the rest of your body. Please take good care of your teeth before they become hopeless. The word hopeless actually sounds hopeless. We need to do that. But thank you so much for being with us. We will be with you every single day, and we'll bring you a new edition every week. Follow us on social media. We are on Twitter at Rela Dental. We are on Facebook, Rela Dental Clinic. Our website, www.reladentalclinic.com, is very active. You can actually go through that website to book an appointment and ask us questions. We are available to provide the answers. Until next time, see ya.